Thinking back on the 5,000 patients I've worked with, the thing that's the most universal problem in practice is stress.
Welcome to Root Cause Holistic Health. I'm Dr. John Harmon, physician, brain health expert, and your host on this no-fluff journey into whole body healing.
And I'm Tracey, wellness coach, mom, and co-host. This is the space where we get real about what actually heals, not just what's trending.
If you're done with surface level advice and ready to understand your body, your mind, and your health from the inside out, this podcast is for you.
We're here for the raw conversations most people avoid. We don't sugarcoat, we don't shame. We offer tools, truths, and transformation.
Welcome back, friends, to Root Cause Holistic Health. Today, we are honored to have Dr. Andrew Rostenberg with us. Dr. Rostenberg, would you like to start by telling us a little bit about yourself?
Absolutely. First, thank you so much for inviting me onto your show. And for the listeners out there, I am a chiropractor and a functional medicine practitioner and researcher. I work in office with patients using advanced chiropractic techniques like applied kinesiology, solving problems physically. And in combination with that, I absolutely love nutrition, diet, and biochemistry. And we use some really effective, powerful tools of functional medicine and just really good science to help solve people's problems. So I'm just excited to be here, connect with your audience, and share what I can to help solve their problems and improve their health at home.
Well, Dr. Rostenberg is a little bit too humble, so I'm going to actually give you the scoop on Dr. Rostenberg. Full disclosure, he was in my clinic when he was first out of school. And I just want to give you my impressions of him when he first came out. For those of you who do not know, chiropractors in chiropractic school, the students, we have between 28 and 33 credit hours per term. And then when Dr. Rostenberg first started in practice, we were having a discussion in my office, and he told me that he actually took the applied kinesiology course 3 times while he was doing his chiropractic work, studying in the 4 years of chiropractic college. So that really, really impressed me because I knew he was dedicated to this. What is also very important to know about him is he's a pioneer in methylation research. That's with the MTHFR that a lot of people have. They don't know what it is. Dr. Rostenberg will tell us a little bit more. He's also a researcher, an author. He's the director of a clinic called Red Mountain Natural Medicine in Boise, Idaho. Graduated in 2011, came into my office and put up his shingle. And I'm just really proud of what he's done, what he's accomplished. Now he's teaching other docs to do similar things. He has a holistic based practice. The tests that he orders gives more information so you can find out what's going on. So many people who have this MTHFR are so frustrated because they take this supplement and that one and this one and that one, and nobody ever finds out that they actually can't do things like methylate, which means that I can't detox very well. So he's transforms lives all over the world. You have a global audience.
We've had millions of hits. I'm a little behind on making content. I'm going to give you my excuses first, but yes, we still get hits and rank pretty high on articles from even 6, 7, 8 years ago. So what was important to me was that I gave everything I had, sort of gave it away, and we became a resource for people trying to solve these problems. And so through that effort, we've attracted a lot of people, who that resonated with, as you mentioned, from 46 different states, 14 different countries, been to China to present. I've been all over the country, and it's just been it's been an honor to, be part of the conversation. And like you said, I'm really, again, mutual admiration here, but I'm also really proud of how you've, watching you change your practice and continue to learn things as you go through your career. I think that's pretty cool too. So I'm excited we get to sit here as successful friends, just throw some pearls out there for people to chew on for a little while.
Oh, thank you. I appreciate that. So you've been in practice 15 years now. What would you say the main reason is patients seek out your help?
Thinking back on the 5,000 patients I've worked with, the thing that's the most universal problem in practice is stress. And as we were talking before the show, I mean, a mother looking at a child covered in red spots with a fever, mother knows instinctively that vaccinating is rolling the dice and playing, Russian roulette with your kid's health. But like, what's her stress level looking at her child covered in red dots with 103 fever, and nobody slept in the house for 72 hours? So I kind of had a stressful start to my life. I think God was giving me an understanding of what stress was from the inside out. And I think at the end of the day, big picture, 30, 40,000 feet before we get into what's the root cause of this particular health problem, I really think stress is the number one reason why people seek me out. And I love that because I think we have amazing tools of all kinds, including some things I refer out to, like your brain balance work, that is just phenomenal for helping patients move forward. So if you're out there and you're feeling stuck, it may not be the only thing you're dealing with, but working with the provider who can understand the stress you're under is so beneficial to you as a patient in the communication and in how the process goes. So I am passionate about helping stressed out people get better.
This MTHFR we spoke about, man, that's getting a lot more attention nowadays, like from RFK Jr. And you've been working with this gene SNP, we call it, which is a variant of the genes that we get from mom and dad. You've been doing that for a long time. What do you think is driving all of this attention all of a sudden?
Well, I think, for my own journey, it's like this irritation that turned into a pearl inside of a clam that started like 15 years ago. I was in a seminar and one of my mentors, even longer than that, probably 17 years ago, the word methylation came out of his mouth. He was talking about, liver detox. And I don't know what it was about the name. Maybe it's just like, someone up above just like tapping me on the head saying, pay attention to this. I just started to learn everything I possibly could about it. And what it ends up being for me as a provider first, as a practitioner of functional medicine and a natural doctor, chiropractor, you're trying to understand why things happen. I really think at a base level, that is a strategy and a philosophy that I hope my doctors adhere to. And I certainly hold myself to that. And I like to challenge my colleagues to get into that headspace. MTHFR helps explain why. The further I dug into this, the more layers down I went, the more I thought, oh, well, that's why that happens. Oh, okay, that explains why that happens. And so for me personally, when you go to chiropractic college, as you know, you have your first trimester, and you do radiographs, you do x-rays of your spine, because we're architects of the structure of the body, and we need to know how things are and if they're healthy, if they're lined up right. And I get my report back, and it's like, you have spina bifida occulta, and you have posterior ponticles, and some of the parts of my thoracic spine are kind of bent the wrong way, and then they come back in alignment higher up. And it said in the radiology report that those are normal variant. Being a smartass and a know-it-all myself, I chuckled to myself, and I thought, okay, normal variant. Well, is it normal or is it a variant? Let's unpack that. And so it turns out that methylation explains why people have short legs and scoliosis, and why they have spina bifida, and why they're born with a cleft palate or a tongue tie or a lip tie, or why they're born with a stork bite. Okay, I'm like, oh, that's interesting. I'm a chiropractor. I'm looking at people physically. We're like, again, the architecture of posture and kinesiology. I'm like, that's really cool. And it also turns out that it has a huge influence on cancer and heart disease and stroke. And I'm thinking of people in my family who died, before I was born of these problems, and then just begins to kind of cascade from there. And so without overwhelming the listeners with the fire hydrant version, what MTHFR does is it gives you a way to understand a fundamental system that if you get it right, everything falls into place. Your detox, your neurotransmitters, your ability to adapt to stress, your growth, your repair, all those things work better. On the other side, if MTHFR isn't being supported the right way, then all of those things I just listed one or all of them could be under pressure and not working well. So that seems like an important system.
I love that we're talking about this. I'm in a lot of mom groups, as we were talking about before the show. I'm in a lot of mom groups. And the MTHFR topic comes up a lot. In fact, there's groups surrounded just with that topic, right? And there's a lot of moms wanting to know, what does a stork bite mean? Like, that's a big indicator, which, as you know, that can lead to questions about, should I vaccinate or should I not vaccinate? So what do you think the most important part of the MTHFR, why is it so important to functional medicine?
It's a great question. I think and even to frame it from the parent's point of view, it's not a flaw. God doesn't make mistakes, and I don't believe the body makes mistakes. I want to point that out, that's a hardcore philosophy for me, that it's absolutely critical that people recognize that the body, that the intelligence that built the body didn't, have a lazy Friday afternoon and forget to tighten a couple bolts. Like, it's perfect. One of the things about working with people that I like is I get to interact with something that's not flawed. I think that's really a blessing. Someone might raise their hand and say, well, what about somebody with Down syndrome or a chromosome problem? And I say, well, okay, the body's perfect, but it's not invincible. So there are random things that happen in the universe. But even after that chromosome is changed, every moment from that moment on in that person's life, the body does everything at every second that we're alive to give you the best outcome possible. And that's the core belief. And I ask my patients and challenge them, and everybody that I've talked to in my practice who's on my table shakes their head and says, yes, I accept that too. So where MTHFR comes into play is that it's a bit like the analogy of if you've ever been kayaking or canoeing on a river or a creek in some natural area where you are. I grew up in Arkansas, and we have wonderful rivers. It's a very verdant, water-filled place, but it's also kind of rocky. So there's certain places where the rapids are extreme. But if the water level's high enough, it doesn't matter. So in the movement of nutrition through your body, in the movement of vitamins, and the removal of toxic waste, in the growth and repair of your body, it's like going down the creek on your kayak or in your canoe. And having an MTHFR gene is like having a boulder stuck in the middle of this creek. Now, if you have one copy, it's half the size. And if you have two copies, it's quite a bit bigger. That can tip you over. It can drown you. Okay. It can be a problem. But if your nutrition is correct, which would be the water level in this model, then if the water level is high enough, it doesn't matter what's on the ground. So MTHFR does make people more susceptible to getting toxic to vaccines. 98% of autistic children have one copy of MTHFR. 98% of autistic children have one copy of MTHFR versus about only 50% of certain populations. Like Italy, just one more thing on this, like Italy, I understand they're very intelligent, creative people, super high achievers in art, design, engineering, everything else, right? Look at their culture. Well, in Italy, half of everybody walking around has one copy of MTHFR. So that means that about 25% of people in Italy have two copies. If you give in to the fear or the panic around this MTHFR gene, you would assume that cancer rates were sky high, that children have massive rates of autism, that there's all these congenital heart defects, and that there's all these bad things happening in Italy, but that's not the case. Their genetics, big boulders on the ground in this model, are overcome by their diet. Look at their ancestral diet. They're eating GMO-free, glyphosate-free bread. They're eating the richest phytonutrients in the world. It's fresh. It's full of folate and methyl groups and choline. And so their water level as an individual in Italy is so high, it doesn't matter the genetics underneath. It's only in America, in the Western world, where we've raped our food quality and just made the most toxic freaking furniture, and everything is off-gassing toxins. When you combine all of that with all the stress and all the vaccines and all the politics, then people come in and smoke's coming out of their ears and they're like, okay, we have some work to do.
That was a fantastic explanation of that.
It was.
Very, very understandable.
I want to back up for a second. So as a mom, like I said, my daughter's 18. She had a vaccine injury at her first well baby visit right out of the gate. I never heard of anything, the MTHFR. It was only, recently, the last 2 years, right? And I've been researching vaccines for 18 years. So it hasn't until recently where, I've heard about it more. And Dr. Harmon touched on it earlier. RFK is doing work, so it's in the news more. But how come we didn't hear about it before? And how would moms I've heard about it. Pediatricians don't talk about it.
It's one of those situations where it's on its own time, and research takes time to catch up to phenomenon that we observe. I think that the research just wasn't there 18 years ago. In the depth that I've studied the issue, the first understanding we had with MTHFR was only related to three things. It was related to depression, heart disease and stroke, and cancer. And that was where the awareness began. I mean, the history of this goes back to like the 80s. There was a gentleman who worked, I believe it was in Harvard Medical. His name was Kilmer McCulley, and he got in trouble for figuring out that homocysteine levels were really high in people who kept dying of heart attacks in their 30s and 40s and 50s. Like, he got, heat for this. Eventually, he was proven correct. And so that's where methylation and MTHFR got its scientific, kind of start. But people began to just look at connections, and so it expanded from there. But yes, I mean, for example, like cancer, I've mentioned that a couple times. What happens is, the reason methylation is so valuable to how our bodies work is, you've heard people maybe have said, you've heard it talked about, that we're like carbon-based organisms, right? We're made out of carbon. Well, methyl groups are just one little pieces of carbon getting passed around. And it's like an economy. It's kind of like the US dollar, lubricating the international financial markets, okay? So if there's enough liquidity, all the transactions happen, bread gets delivered, meat gets delivered, bills get paid, whatever. Now, when you have an MTHFR problem and you get a hit with a toxin, all of a sudden it's like you have a lot more spending you have to do with these methyl groups to manage this toxin, because the toxin will not voluntarily leave your body. You have elegant systems to remove it, but those systems depend on methylation. And so if you're slow at methylating, you're only going 30% as fast as you're the other kid down the street who got the same vaccine. And so in that difference in speed, the toxin levels allowed to circulate longer and damage and hurt people more. Kind of, people with MTHFR are kind of like the canary in the coal mine. So it's a good question. I just think it's one of those things that it just takes, unfortunately, right? People have to suffer, and problems have to go on. Stuff has to get bad before we scratch our head and go, geez, what's causing this? But now we have all that. Now the tide's turning, and moms are out there rolling up their sleeves and, ready to deal with this and optimize themselves and their families, which is so good to see.
And Doc, when you add to that it takes about 20 years after something is discovered before it ends up in med school books. I remember hearing that in chiropractic college.
Isn't it crazy? You spend all this time and money in school, but you also know that it's 15 to 20 years behind.
Yeah.
Oh my gosh.
And that's why you have almost zero medical doctors. Maybe there are some, but I really haven't seen any that talk about that with their patients, like pediatricians. They don't tell their moms about, your child may not do well with this. Well, maybe we should find out if it has one of those genes that affect detox.
I think that's the future, and I think medical doctors, I'm not one, I don't want to paint with a broad brush too bad, but they're under pressure, they're indoctrinated, they've been a resident staying up for 70 hours at a time. They kind of indoctrinate them into the model. So you have to be compassionate, and just remember that, if we're all helping our patients, we all work for the same team. Sometimes it seems like medical doctors are not on our team, and I think based on results, I think that's an argument we could make, but just continue to make the ones that are on your team successful monetarily and give them that great satisfaction in practice, and more doctors will want to jump on that ship. And that's what's happening.
Yeah, it wasn't until just 5 years ago that I ever saw someone who was an MD actually put up a sign that said functional medicine doc.
It's such a new science. It's so new. And that's one of my passions too, is having been confronted with trying to explain MTHFR, trying to figure out how to identify those who need the help and also help those with the problem. I love teaching, and so I have a coaching program called Well Power. You can find out more. I'll give the link in the notes if you want to learn more about that. But that's one of my passions, is just to get more doctors, give them the courage and the confidence to step into this role, because I mean, I've had up to a 4-month waiting list at times, and I'm just one person. I'm like, the way to really make difference is let's get 100 or 1,000 people doing this also. So
isn't that interesting? Dr. Rostenberg was so successful, he wants to share it to take the burden off his practice.
I love this.
That says a lot right there, Doc.
Mm-hmm.
Yeah, it does. And just to show you how much I trust him, I've sent my in-laws to him. So,
oh my gosh.
I mean, that says a lot about my confidence in what he does. And I've seen that over the years. So, Doc, how does the average person know, or what should they look for to say, hey, I need to talk to this doc. I need to go see him or do a telehealth.
I meet people probably a lot like your experience with your practice. When I met you with your more advanced oxygen therapies and then into the brain work, that people have to, I don't want to say this is a guarantee, but people have to usually fail and get stuck for a while before their mind opens to a different point of view. Now there are exceptions. I have some wonderful like Gen Z 25-year-old guys with like great jobs and they're fit and they're healthy. Like, hey, I just want to detox and stay on top of stuff. I'm like, dude, if you represent the new generation, like, let me give you a high five. That's awesome. But when things don't make sense, that's when functional medicine and this kind of work in my office really comes into play. Is when you've been stuck and unable to move forward. You've tried different protocols, you've worked with different doctors, everybody gives you a different answer, nobody knows what's wrong. It's a good time to get another opinion, because bodies don't make mistakes. And a lot of times, as much as my passion has been MTHFR and methylation, I learned through experience, a lot of what most of what I know, actually, my patients have taught me. But you can't just pigeonhole yourself and look at genetics. You got to zoom out and go, okay, environmentally, what's going on? Do we have an airway? Can we breathe at night? Are we snoring? You were on 38 rounds of antibiotics. Is that right? 38 rounds in the last 15 years? That might be something we need to treat first, because that has damaged something so important that itself would be causing MTHFR problems for you. So it's really just, that's what I like about the work, is everybody's different, but the concept is like, everybody has a gut problem till proven otherwise. And that's definitely true of MTHFR people, of methylation people. Kids who have been injured with a thimerosal and aluminum and all these other adjuvants, it didn't just hurt their brain. It lit their vagus nerve up. Their gut totally changed. The bacteria profile is totally different. And so we know that, food is medicine. Supplements are concentrated food. But like, how do we absorb what we eat, right? So I grew up in the Michael Jordan era of basketball, and it ruined me for the rest of my life, as you well know, that he's the greatest of all time, of course.
Yeah.
But he was so fundamentally good at just the fun. He would always say, fundamentals. He's all about fundamentals. And I if I can steal that idea in my practice, it sounds complex, right? Methylation, genetic testing. But at the end of the day, everybody, it is still the fundamentals that get me the most results. Like, I dealt with really bad blood sugar problems growing up. My life was, I'm a latchkey kid. I'm part of the generation. My parents just weren't around when you get home from, parents just were doing their thing and you're doing your thing. I didn't eat well. I had low blood sugar for a long time. And it ruins your neurotransmitters. When you don't methylate fast like me, and then you don't eat enough calories, your blood sugar is low, it just wrecks your dopamine levels, leads you into addiction, self-harming behaviors, mood issues, focus problems. I mean, like, how many kids are dealing with that? How many adults?
What would you say to the doctors who watch this podcast on how do you go about helping them? Do you have online things? Do you have in-person seminars that you do or anything like that?
What I would say to the doctors is that voice inside your head that says, I'd like to learn more about that. I'd like to know about that. I'd like to be a resource for my patients. When my patients come in and ask questions that I am not maybe comfortable answering, I mean, that can happen once in a while. Everybody's going to get a question outside of their
Sure.
total knowledge base, but that's the future you trying to get your attention to get this information as part of your toolkit. And I'm absolutely passionate about teaching. I've taught hundreds and hundreds of providers. The online course is one way to learn. It's it's self-directed, 12 modules. It teaches you, the philosophy and the basic the basic idea is that 20%, it's like Pareto's principle, right? 20% of the information in functional medicine, including MTHFR, COMT is another important gene, very important that we look at for how it affects patients' detox. But 20% of the information in the functional medicine universe creates 80% of the positive changes. So
Wow.
20% of our tools solves 80% of the problem. So I just drill people on that. They're so confident in that 20% that it relaxes them neurologically, right? Less stress. And it frees up their brain power to be creative and think outside the box when a zebra walks in who doesn't fit in that 80% group. That's how I do it in my practice, and it's a proven system. It's not just off the shelf, here's what everybody does. It's like, I would encourage anybody listening who wants to learn more, just reach out. My email and contact will be in the notes. And I have also worked with people one-on-one. So there's lots of options for training. If you have a will to get better, you need coaching, you need someone who's passionate about that. That is what I love to do.
So you mentioned something earlier that I know moms in our audience are waiting for you to mention again, or they're like, I have more questions, because as a mom, I know that I have more questions. The famous stork bite. So if you have an infant, what are other, because people don't know that that's a sign of having the MTHFR gene. And actually, then there's things that you need to know about having that gene, right? If you have an infant that has that gene, you need to know certain things, there's certain testing. So A, what should moms watch out for on their infants? And B, should all infants just be tested for this gene when they're babies?
So this is really getting into how vitamin B9 folate works in the human body. It's so interesting, okay? I mean, there's like 50 different vitamins that you have to have, or you'll have some kind of disease, or your life will end. I mean, it sounds dramatic, but it's true. And B9 is just one of these 50. But what's so interesting about it is it has an influence on the final shape and symmetry of our body. When I learned that, I was just like, it blew my mind. I was like, wow, a vitamin will change the shape of my body and the way my children look, and the way other people look when they go to the swimming pool. You'll see the kid with a dent in their chest, or a kid with a leg length that's different. And so those physical signs that we see are visual tells. That family line, especially that individual, but like the parents created that individual, that baby, that kid likely has a problem producing enough B9. If we went back in utero, like I've said this, I often say this, like, I don't know if it's for 5 minutes or 5 hours or 5 days, but there are periods of time when a baby's growing constantly in utero, where if there's not enough B9 available, the body says from this hour and this day till this hour on this day, we're going to close the neural tube. The neural tube's going to close, and then the timer goes off, and then the next thing starts. It's really incredible. But if you don't have enough of this B9 in mom's body getting into the placenta, that process of growing and closing the neural tube stops, and there's a little opening left. And that's what spina bifida is, because it just didn't finish in time. Does that make sense?
Yeah.
Yeah. So then look at a more severe one. Look at congenital heart malformations. A baby's 9 months. Beautiful baby. Everything's good. Good APGAR score. Oh, but by the way, it turns out baby has a little hole in their heart. And you hear that, you're like, that sounds terrible. What it means is the baby's physical body's 9 months old, but the heart only grew in utero about 7.5 months. So it's immature because there wasn't enough folate in the environment for everything to grow and divide as fast as possible. Some of those congenital heart babies will naturally catch up and close and have a normal heart a few months later. And again, some of them, heaven forbid, have to have open heart surgery at 2 years old, and imagine the stress that places on the mom and the family, right? But again, that's medicine doing a good thing and helping. So to the moms listening, like, I think it's a personal choice, as is vaccinating, whether you want to test your genetics. It's a rabbit hole that I only want people to do it from the perspective that it's just part of the story. It's not a death sentence. Your genes are not your destiny, but they're going to be what your tendency is when you're under stress. So it kind of depends on a person by person basis. But if there's a family history of cancer, depression, mood issues, cardiovascular issues, if mom had like issues with blood clotting during pregnancy, depending on how complex the story is, I'm definitely going to recommend, testing genetics. There's like tons of companies that do that. You can blood test for MTHFR. You can send in your saliva and do genetic testing. And then typically the saliva makes a lot more sense because for one test, you get like 50 genes versus paying for one blood test. But I guess suppose if you had to pick, either one will give you your status of MTHFR, but we usually see people do, I would say we see 50 saliva genetic tests for every one blood test that we see, if that makes sense. So
that'll give the moms some good things to go on to judge whether or not they need to go down that road. That's some great information, Doc.
Fascinating subject.
It is. And I can tell you've talked about it a few times. Kudos to you. You've really helped thousands and thousands of people, but also doctors all over the world getting this information. And that's really, really important. And we hope that this interview even gets that information out further. Do you have a basic PDF or something?
I would recommend that people who are interested to get the book I wrote on this topic called Your Genius Body. And it's...
Oh, nice.
That book has all of this in there. And that way you can go back and I probably should have wrote 6 books. I kind of just fire hydrant dumped it all in there. I was like, I don't know if I'm going to get time to write another book. I better just put it all in there.
With having young kids that are really active in sports.
That's part of the chat. Yeah. I'm like, God's just having me in a different season. And I got to keep working on, going on his calendar, not mine, but I'm glad I got it out. Yeah. The book, Your Genius Body, would be a good resource. It goes through all the gut issues, the hormone problems, the neurotransmitter issues. It talks about genetics. The first couple of chapters would be the most useful for reviewing the kind of things that we just spoke about. So
yeah, with that much information, it definitely needs to be a book that they read. But that'll give them a lot to go on and guide them as a parent for the next step that they would need to take.
It's a lot.
We appreciate, don't we, Tracey? Appreciate
Absolutely.
coming on. First of all, for the knowledge that we gained that's going to be passed on to everybody who watches this podcast.
We're friends personally, and I've appreciated your trajectory as a practitioner, that you kept learning things as you transitioned, later through your career. And I think that's kind of inspiring. And there isn't one clinic that does everything. And and doctors need to know that too. What you want to do is build a team. As a patient, you want to work with people who respect your points of view and can communicate and teach you things. Because to me, that's what a good doctor does. They don't just do stuff to you. They help you live a better life. And I think that's what doctors are called to do. And then as the provider, as with your brain balance work, I've seen great results with that. And I have good dentists I refer to, and myofunctional therapists. So it's like, I would say at this point in my career, I see myself more as a quarterback for people to solve problems. And the idea that I'm going to do it all in my practice, there's a lot that I do, but I find a lot of value helping be the consultant as well. When you're finding doctors as a mother or a family out there, support those people who are good quarterbacks for you and good consultants, because they're valuable. Keep them around because you need them from time to time. So
you never know what's coming. And Tracey, do you have any I know you're back there chomping at the bit because you're the mom, and moms have to be so protective, and they have to be warriors watching out for their kids.
Of course they do. I love all of this information, and I'm very honored and blessed that you took the time out to sit with us and go over all of this today. And like we've talked about, the MTHFR gene is just coming out the last few years. I'm thankful and grateful for all the work that you do. And I really am excited that we are able to refer you out as well on all of our sites, because I think that there are definitely practitioners and, maybe MDs or chiropractors that want to expand into functional medicine. I am a big proponent of chiropractic care and functional medicine. We talk about it all the time. In my personal life, I talk about it every day. And I am very excited that you want to teach others to expand their knowledge, maybe expand their practice, because it's what's coming. Our society as a whole is wanting more. They don't want this standard, here's a script, take this pill and you'll be fine. They don't want that. They want to know more. They want to know why. It's like the 25-year-old that went into your office for a detox. I'm so excited to hear that. I'm 48, and I don't think at 25 I would have been wanting to detox. So I'm excited.
Or even knowing what it was.
No. So I'm really excited for the younger generation. That gives me hope that we're getting through. People like you and all of us, our team, we have this huge team. I feel like we all can't do it all. And as moms, it's so hard, being a first-time mom, you're pulled in so many different directions. You have your in-laws, you have your spouses, you have your parents, and then you have your other moms and telling you what to do, and your pediatrician telling you what to do. And it's really hard to know what to do. So I'm really glad that there are doctors like you that are out there that are sharing knowledge and going the extra mile and learning all that you can.
I think my dream would be that we change the conversation so dramatically that functional medicine is just the standard of care. And I think you're right that I'm a fan of Aura rings, right? You've heard of those,
Yep.
They're now selling blood work. So I'm thinking to myself, millions of users are now going to be buying blood work from Aura Ring. They're going to run it through an AI generation system, and they're going to get advice. And that's okay. I do believe in my heart of hearts that my job and this position that we occupy is AI proof. I don't want to sound like I'm threatened by it. I think it's a cool tool, but you're dead on that it's a democratization of access to your biological data, right? So you don't have to bend the knee and go through the steps and get a crappy little blood test. You can just buy what you want. You can test what you want. And I think that's a good thing. I think it should be available. I, of course, want to be in the information of people like me in your show. I want us to just educate people on how to get the absolute best results possible from all the work they're doing. So it's going to be a wild next few years. It's actually an awesome time to be, this field is exploding right now. So great place to be.
That's why you're looking to teach other docs so they don't all come to you and you don't have any time to go to a baseball game.
Exactly. 100%.
Thanks so much for coming on. You're going to help a lot of people through this podcast.
Love to hear it, guys. Thanks so much for the invitation. It's been great to chat with you both.
Thank you so much. And thank you, friends. That's a wrap. And stay grateful and grounded. Until next time, friends.
Thanks for tuning in to Root Cause Holistic Health. We're here to help you uncover what's really going on and empower you to take the next step in your healing journey.
Whether you're a mom, a dad, or just someone ready to stop settling for Band-Aid fixes, we hope today's episode gave you something to think about.
If you found this episode valuable, do us a favor, share it with someone you love, and leave a review so we can reach more families like yours.
Make sure to hit follow so you don't miss next week's episode. We've got more honest conversations, practical tips, and root cause wisdom coming your way.
Until next time, stay grounded, stay curious, and most of all, stay connected to what truly matters.
We'll see you next time on Root Cause Holistic Health.